Welcome to the Career Day presentation for the TEACS EMS program. I am Carl Voskamp, the training manager. The EMS program is part of the Emergency Services Training Institute, which is a division of TEACS. The EMS program offers training that leads to three different levels of EMS provider. First of all is emergency medical responder, followed by the emergency medical technician, and finally the paramedic. The emergency medical responder initiates immediate life-saving care to critical patients who access the emergency medical system. This individual possesses basic knowledge and skills to provide life-saving interventions while awaiting additional EMS personnel and may assist higher-level personnel at the scene and during transportation. In many areas, EMRs are sprinkled throughout the community and can be dispatched along with the ambulance when someone calls 911 for a medical emergency. The EMR is usually closer than the ambulance and may get to the patient quickly and provide life-saving care until the ambulance arrives. The EMR course is a total of 64 hours, divided equally between lecture and skill lab. There are no clinical or field experiences associated with the EMR course. The emergency medical technician provides basic emergency medical care and transportation for critical and emergent patients who access the EMS system. EMTs function as a part of a comprehensive EMS response under medical direction. EMTs perform interventions with basic equipment typically found on an ambulance. The TEACS EMS program is a total of 280 hours of training, 160 hours of lecture lab, with 100 hours being of lecture and 60 hours of skill lab. There's 120 hours of clinical field experiences, which comprises of 5 8-hour shifts in an adult emergency department, 1 8-hour shift with respiratory care, and a total of 72 hours of EMS rideouts, which may be in either 12 or 24-hour shifts. TEACS offers the EMT program in a fast-paced and a slower-paced program. The faster-paced program meets Mondays, Wednesdays, and Fridays from 8 a.m. to 5 p.m. for 8 weeks. The clinical and field experiences begin after the fifth week of class. The students are given up to 2 months after the classroom to complete all clinical and field experiences. The slower-paced program meets Mondays, Wednesdays, and Thursdays from 6 p.m. to 10 p.m. for 14 weeks. Clinical experiences begin after the 8th week, but students again are given 2 months after classroom completion to complete all clinical and field experiences. The Texas Department of State Health Services, abbreviated as TXDSHS, or we call DSHS, is the agency that certifies EMS personnel in Texas. Requirements for certification include: you must be at least 18 years of age, must have a high school diploma or GED, must have successfully completed a DSHS-approved EMS training course, which TEACS is, submit a completed EMS personnel application and pay the certification fee, must pass the National Registry certification exam, and you must submit fingerprints for Texas and FBI criminal history checks. The paramedic provides the most extensive pre-hospital care. Through assessments and providing medical care, their goal is to prevent and reduce mortality and morbidity due to injury and illness. Paramedics primarily provide care to emergency patients in the out-of-hospital setting. In addition to basic level care, paramedics may administer medications, interpret electrocardiograms or EKGs, perform advanced airway procedures, and use monitors and other complex equipment. It is a Texas Department of State Health Services rule that individuals must be a certified EMT before they apply for a paramedic program. In our program, there are 4 online courses that should be completed before the start of the lecture lab phase. The online anatomy and physiology, pathophysiology, medical terminology, and medication calculations courses are asynchronous and are self-paced, but must be completed by the designated deadline. The classroom phase has 188 hours of lecture and 132 hours of skill lab. The clinical phase totals 600 hours. There's 240 hours in either 8 to 12-hour shifts in adult and pediatric emergency departments, airway intervention lab, cardiac cath lab, the intensive care unit, labor and delivery, and finally the newborn nursery. There are 240 hours of formative EMS experiences that are done in either 12 or 24-hour shifts with a variety of EMS organizations, being fire-based, municipal, or private organizations, and several different preceptors. We want you to experience all facets of EMS and find the person that you would like to be your mentor. The 120-hour capstone EMS internship is the last phase of training and should be with one department and preferably one preceptor. We have a fast-paced and a slow-paced paramedic program. The fast-paced program meets either Monday and Wednesday or Tuesday and Thursday, and every third Friday from 8 a.m. to 5 p.m. for 18 weeks. The clinical experiences can begin after week 6, but students are given 5 months after the classroom phase to complete all clinical and field experiences. The slower-paced paramedic program meets Tuesdays and Thursdays from 6 p.m. to 10 p.m. for 40 weeks. In clinical experiences begin after 15 weeks. The students are given 4 months after the classroom to complete all clinical and field experiences. Graduates are eligible to seek certification from the National Registry of EMTs and the Texas Department of State Health Services. EMR and EMT graduates must pass a National Registry written exam in order to get certified. Paramedic graduates must pass a written and a 6-part practical exam in order to get their certification from National Registry. Nationally registered EMRs, EMTs, and paramedics use their National Registry certification to apply for certification or licensure from the Texas Department of State Health Services. Instead of EMR, Texas calls that level ECA, or Emergency Care Attendant. Texas has both certified and licensed paramedics. Certified paramedics have completed courses like ours. Licensed paramedics have completed college-level courses and have a degree. Most EMRs are volunteers or have another primary duty. They may be a member of a community volunteer fire department or EMS agency, or they may work in a plant or construction site and are part of that organization's emergency response team. There are 2 facets of EMS: 911 pre-hospital care, where we assess, treat, and transport patients into the healthcare system, may be by fire-based, municipal, or private organizations, may be by ground, ambulance, or helicopter. Then there's the interfacility transports, where we treat and transport patients within the healthcare system, primarily from one hospital to another. This may be by ground ambulance, helicopter, or even airplane. May be non-emergent or critical care transport. Regarding jobs for EMTs, in addition to being on an ambulance, EMTs may work as emergency room technicians or safety and first aid personnel on job sites. Work schedules may be 8, 12, 24, and even some now working 48-hour shifts where they work 2 days and are off 4 days. This includes nights, weekends, and holidays. Salaries in Texas range between about $33,000 a year to almost $41,000 a year, or a start of about $15 per hour. In addition to being on an ambulance, paramedics may work as emergency room technicians, community health technicians, or mobile integrated health care providers. Shifts are again 8, 12, 24, 48 hours, and includes nights, weekends, and holidays. Salaries for paramedic in Texas range between almost $39,000 a year to a little over $49,000 a year, or starting pay of about $19 per hour. Thank you for your attention. You will now see several video segments of students in training. The video is narrated by Nick Sutton, EMS Program Skill Instructor. If you have any questions, please feel free to contact me. Thank you. Have a good day.
Hello, everybody. My name is Nick Sutton. I'm the lead skills instructor for TEACS EMS. I'm here to talk to you today about TEACS's EMT Basic program. The EMT Basic program is here to start your career within EMS or firefighting. In the state of Texas, to be a firefighter, you must become some sort of medically trained, and the most basic level of that is going to be the EMT Basic. Here within EMT Basic, we're going to teach you how to treat patients. We're going to stop bleeding. We're going to manage the spine so that we don't cause any more injuries. We're going to teach you how to extricate people out of vehicles. We're going to teach you CPR and how to help the paramedics to that next level of the advanced cares. From there, after EMT Basic School, your career doesn't just stop there. You have the opportunity to do so many more things. A lot of people that I know go on to become paramedics. We also run the paramedic program as well. So have people that go from EMT Basic and go out there to become nurses. Some people become doctors. I've had some flight paramedics, flight nurses, technical rescue teams. So the list goes on of things that you can do with this career. It's the first step in getting out there and getting into this world of emergency service. It's a great career. I've been a firefighter paramedic since I've been 16 years old. I started out as an EMT Basic, just like what I teach now. And when I was 16 years old in Pennsylvania, from there, I went on to become a firefighter as well. When I turned 21, I became a firefighter paramedic after going through the TEACS paramedic program. And now I've worked for the city of College Station for nearly 8 years as a firefighter paramedic, and it is such a great, rewarding job. But all that had to start with something, and that was this EMT Basic program. It is such a cool program. You get to meet so many cool people that come through here. The instructors have a wealth of knowledge to tell you. We have people from all over the state of Texas that come in here to help us teach. We have had students come from Oregon. We've had some from New Jersey, from Kansas, all the way up in Maine, Florida, California, all over the country have come to learn with us. And it's such a cool facility to be able to learn and teach us. So a little bit about what we do is you see these students here going through. They're kind of sitting around watching. That's me teaching them how to do some splinting. This is just simple, basic things, first aid things that you might learn in the Boy Scouts and such. It seems a little tedious and such, but this is really this right here. This simple task of bandaging their leg like this will help relieve pain, and that's what we're there for. We're to help people. So if you have that drive to help people, that's what we do. We teach you that. On top of that, we teach you how to protect yourself with scene safety. Teach you how to go to the next step and think outside the box. Because it's not just a job where you walk into and you just say, okay, this is what I'm going to do, X, Y, Z. I'm going to go ahead and fill out this kind of paperwork. No, it's a thinking on the job, on the spot kind of job. All right. It's very easy to teach these students right here, like what they're doing, these board splints and such, for a simple fracture of the leg. But this is best case scenario. How is this going to be presented to them? When it comes down to it, they may have to tweak this idea just a little bit. So if you're one of those people that are go-getters and like to come up with solutions, and basically, if any of y'all have ever seen the old show MacGyver or have heard of the term MacGyvering it, that's what we do. We're there to help on a bad day, when at the people's worst day. We come there to help them. So it's a very rewarding career. I've got to meet some really cool people over the years. A lot of veterans, people who have traveled, people that are very thankful for what we do. They sit there and, wow, I'm so glad that you came today. And sometimes we're like, man, it's just a stub toe. Why? Like, you didn't even need to call us, really. But for them, that was their emergency, and we get there to be helpful. It's a great, rewarding career. What they're doing now in this is how we take people down out of steps. So whether it be off the porch, if it's down a flight of stairs in a house or such, this is one of the devices that we use. It's called a stair chair. We put people in it, and two people just basically wheel and carry them down. This is kind of an older model. There are cooler models out there now, like these little track systems, and they slide down and everything. Um, Here at Teeks, I don't have all those cool things, and not because of a lack of funding or anything like that, but I want to teach you on the most basic equipment there is. So that way, when you get out there, you know how to use those things. Because not all agencies out there have the money to buy those cool, latest, greatest toys. They're great. They help keep us safe and reduce injuries and such. And I'm all for that. But you get out there to some East Texas or West Texas little volunteer departments or little departments that barely are keeping the doors open. They have equipment just like this. And when you walk in the door and know how to use these manual tools, man, they'll hire you on the spot because there's so many people out there out teaching with these new latest greatest technologies. When you get to the simple basic equipment, they don't know how to use it. So it's while it does look like we have the lesser of the technology, I will tell you, we're not only we're using the lesser technology so you know how to use the most basic equipment that you're going to have. And then on top of that, what we do teach you is the best way to use these and how to use those technologies, because guess what? Technology breaks. We have the power stretchers. You don't know how many times those power stretchers have died on me. And then I have people that don't know how to use the manual stretchers. So we make sure that we teach you appropriately. As you can see, they're using proper lifting techniques, all right, to reduce the back injuries and how to use this equipment. That is going to help you in the long run. So the other great things about Teeks is just the amount of exposure you get. Everybody that comes in there, every single one of our instructors are EMT paramedics. All right. They all have worked out in the field for many years. As you can see, Eldon there teaching. I like to pick on Eldon. He's one of my buddies. His EMT number is like number 3. Moses and Jesus had the first 2, So love Eldon dearly. He's a great instructor. We take great pride in what we do and what we teach you, because you never know when we're driving through your area, who are we gonna run into if we get into a wreck? I want to make sure that you, the student, learns everything you need to know to take care of me, or more importantly, my family, if they come through your town. So we take great pride in that. We take great pride in our safety as well. As you can see, we all understand we've been affected by COVID. We've been affected as well as hard as it's been to kind of get back to teaching face to face with all the COVID procedures. We've been doing more to help reduce those. As you can see, all the students are wearing masks as well as wearing gloves. We obviously are still doing touching and handling patients because that's the best way to learn, but we need to be safe at the same time. So we make sure that we're wearing gloves and masks and taking appropriate precautions as we go along. In this scene, you can see the gentleman is laying on the ground. The other student, he's doing a few things, touching the patient, but then he keeps looking at Eldon, the instructor. Basically, what we do is we have to simulate some stuff. So obviously, I can't make this guy quit breathing or make his pulse stop. So we have to touch a patient and ask the proctor, okay, what do I feel for a pulse? All right. They're looking, do I see any major injuries, any major life threats? All right. They're coming across. As you can see, she's touching the head. We're looking for injuries. So this is one of our trauma scenarios where they're looking for injuries on the patient. As they go along and they find certain injuries, Eldon there is telling them, hey, you're finding this on the leg and such. They will go ahead and treat as appropriate. We do also, this is the beginning stages of this program. These guys, they're in like one of their first 2 days. So they were very minimum on what we're doing. We're kind of just starting the basics and walking through the motions. As they progress, we're going to get into actually doing more simulations where we're using mannequins and dressing up and doing some, taking off some, parts of clothing to make injuries appear. We'll do a little bit of makeup and moulage to make it more fun and more realistic. Our goal is to make it as realistic as possible. And I say as possible because obviously I can't make somebody die for you to practice on them. But we do our best to get it as close to realistic as we can, because that's the best way to learn. So our primary goal when we teach you the skills is going to be show you one thing and then have you practice it, and then we test you out on it so that way we can say to the state they're proficient. I know I've talked a lot about skills and such, but then that's not the only portion of it. I know this the fun part is all the skills, but there still is didactic portion in the clinical portion. So you still have to do some book work. You still got to get in the book, do the reading, take a couple tests. They are somewhat difficult. They are basically an entry level college class is what we're getting into. We start looking at like the anatomy and physiology aspect of it, but it's nothing that nobody can't handle as long as they put their mind to it and actually take the process and do the work that they need to. So as long as you're able to get in there and study, even just for a couple hours a day, and rely on working with your instructors and working with your other fellow students, it's a cakewalk. It really is. Then on top of it, we have the clinical phase. So some of you may be sitting there going, man, I really don't know if that's what I want to get into, because we talk about EMS, you start thinking blood, guts, and gore. Can you handle that? Can you handle seeing somebody that has passed away or in a very injured state? You don't know. Really, you don't know till you get in there and do it. So for two reasons: one, to get you the exposure to really understand what you're getting yourself into, and number two, um, getting your hands on live patients. We send you through the clinical portion. The clinical portion is pretty simple. It's going to be about 48 hours in the ER, so 3 or 4 shifts in the ER, and then you have 3 or 4 shifts on the ambulance, and then you have a couple shifts in various other parts of the hospital, such as the respiratory care, the labor and delivery, and those types of things. All in all, it could take you about a month and a half if you're really working hard at getting them knocked out. You don't have a whole lot of other things going on. But you could still work a full-time job or have a full-time school schedule and still be able to do these classes and still be able to get these clinicals done. The clinicals are probably my favorite part. I love doing the skills in the lab and teaching and all that, but really the clinicals is where it's at. I mean, you get to go do the job. You're out there physically touching patients, talking to patients, and getting to meet these people and learn from other nurses and doctors and paramedics and other EMTs out there. It's so much more fun than just doing it in the lab. And when you do that, you get to spend some time in the ER, like I said. You'll take vitals, you'll help move patients, you'll help with cardiac arrest, you'll help with procedures. Anything we've trained you to do, you'll get to do. And then you kind of get to take that, ask them more questions. I've had students that are EMT basics that have kind of liked the idea of the cardiology, talking about the heart and the heart rhythms and what do they do. And they come back to me and like, hey, I talked to the doctor about this and they were telling me all about this. It was so cool. I had a great experience. And it's just so much fun. It really is a fun and rewarding career. The career itself, I mean, you can go out there and work on 24-hour jobs where you work one day, you're off for 2 days. There's some services that you're on for 2 days and off for 4 days. They have regular 40-hour work weeks. There's so many possibilities out there that you could do with this job and take it even further if you wanted to. It's a great program to get into. It's a great career. I wouldn't change it for the world. This is obviously one of the coolest jobs ever. Where else do you get to go out and run down the road with lights and sirens and go through red lights and stop signs, make people get out of the way, and get to help people on a regular basis? Now, when I say help people on a regular basis, please don't think Chicago Fire or Lone Star 911, because that stuff doesn't happen like that. Let me tell you, it is not like that at all. But sometimes just going out there and being there for those people on a day that they just feel is the worst day of their life because they're having trouble breathing or they're having some chest pain or they're going through an emotional state, just being there for them gives you so much more of a rush than you will ever believe. It's better than a roller coaster, I swear. Getting to actually get there and have one of those days where you make a save, it is amazing. It is one of the greatest jobs in the world. So I really highly recommend going into this field and coming to visit us here at TEEX to become an EMT basic. If you ever want to talk more about it, please feel free to contact me. Very simply, my email is nick.sutton, that's nick.sutton at TEEX, TEEX, at tamu.edu. I would love to give you a tour if you ever want to, and we will can show you all around all we do. It's a great facility. We have the greatest instructors in the world. I know I'm a little biased, but we really do have some of the greatest people out there to help teach you how to become a great EMT basic, and then hopefully one day further your career. So I appreciate your time. Thank you very much. You all have a wonderful day.